Good afternoon, and thanks everyone for being here. It is hard to believe that it's already August, and it has been 5 months that we've been dealing with COVID-19 in Missouri. August also means that the new school year is quickly approaching. On Monday, DESE and the Department of Health and Senior Services released updated school reopening guidance that addresses more frequently asked questions about the upcoming school year. This document, which was initially released on July the 9th, now includes information on reactive strategies that Missouri schools should be prepared for with the reopening, such as what to do if a student or staff becomes symptomatic at school, how to handle positive cases of COVID-19 in school communities, and how to best assist local health officials with contact identification and tracing. Over the last week, we have also met with K-12 school administrators and teachers from across the state to discuss their plans for this fall and how they are navigating the challenges of COVID-19. We met with the administrators and educators in Jefferson City, Neosho, Springfield, St. Louis, Kansas City, and Northeast Missouri, along with their surrounding communities. We talked through their different needs and challenges, and it was encouraging to hear about their plans to safely resume teaching, whether that be in-person classes, virtual learning, or a combination of both. I do want to say, after traveling the state, meeting with many of the superintendents and administrators, the one thing was a common thing. People were ready for their kids to go back to school. Most of them, I would say, in rural Missouri, for sure, 90%, most of the superintendents saying their parents are wanting their children back in school. They've also, many of them have been very articulate of how that might look and give students the opportunity to go virtual if they wanted to. So, and I think the other thing that the administrator said, I believe the teachers was ready for school to start also to take on that obligation. The other thing I will say, the preparation that they are making, the summer schools that they've had, a lot of them were test runs simply for the school to start, but they are doing a lot of unique things. The school administrators are doing a really good job trying to bring these kids back in a safe environment, trying to protect the teachers and everyone else. But I was really pleased how much they were ahead of that and preparing for schools to go back. The other thing I would say they stressed was how important it was to get those kids back into school for multiple fronts. So it was very encouraging for me as the governor to go out there and see how ready they were and encouraging that. And again, I'll say this in the speech, but all school districts are different. And I want to thank our school administrators, teachers, parents, students, school nurses, maintenance crews, and all school staff members for working hard for our Missouri kids. We were very grateful for all you have done to prepare for this school year and making sure our students stay healthy and safe as possible. There is no one-size-fits-all in the schools. Every school district will look differently based on its unique needs. And we will continue to focus on the health and safety of our students, school staff, and communities as a whole as we move forward with this school year. As we continue to respond and adapt to COVID-19, I want to again call upon local leaders across the state to prioritize the distribution of their CARES Act funding. The supplemental spending bill passed by the General Assembly required the CARES Act funding to be distributed within 10 days of receipt of the state treasury, which we did. But so far, much of this money has not been distributed to those on the front lines of the public health response. I cannot emphasize enough how important it is for these funds to be distributed and utilized, especially when it comes to testing and contact tracing. As I discussed during last week's briefing, the state has an important role in supporting contact tracing at the local level. and we are doing everything we can to assist in that effort. However, as also I said last week, state government can help, but contact tracing largely depends on our local public health agencies. That is why it is so critical that our local health departments receive the CARES Act funds so they can continue building up contact tracing and testing efforts in their communities. In addition to the federal CARES Act funds and our efforts at the state level, there are also other opportunities out there to strengthen contact tracing capabilities. Johns Hopkins offers free guidance and resources for implementing successful contact tracing, including a free online class. The course is available to anyone that teaches the basics of interviewing those diagnosed with COVID, identifying close contacts who may have been exposed, and providing them with self-quarantine guidance. We strongly encourage not only local governments, but also businesses, school leaders, and many other organizations or individuals interested in contact tracing to use this free resource. As many of you know, Missouri has recently included as one of nearly half of the states in the United States that the White House is concerned about increased COVID-19. On Sunday, Vice President Pence personally called me to offer additional assistance and resources as Missouri continues to fight this virus. We are grateful to both our Vice President and the President Trump for their continuing support throughout this process. All 50 states dealing with COVID-19 for months, and we have been very fortunate that our increased testing, box-in testing, community sampling, and sentinel testing efforts have helped us manage this virus in a way that up until recently kept Missouri off national COVID-19 watch list. Although we are seeing an increased number of cases, we are in a different place than we were in March and April. We know more about the virus and how it behaves, and we are better prepared now to respond. It is important to note that these recent increases were partially due to the backlog of data at the state level. This not only delayed results getting to local public health agencies or patients. This did not delay test results getting to local public health agencies or patients. This was a backlog of test results as they were being entered into the state system and reported out to the public. I'm happy to report that that backlog has been eliminated as of last Friday, and our team at DHSS is back to reporting each day what has come to them in the past 24 hours. When that backlog occurred, I think it's also important to realize 6 weeks ago we were doing 4,000 to 5,000 tests a week. In just less than a month, we are now doing over 90,000 tests a week. And you can see what that does to the system. But we're caught up on that, and we're ready to report that on a daily basis. There are still some testing delays with the national labs, but this situation is improving also. Just as we have from the beginning, we continue to monitor the number of cases, hospitalizations, and severity of the symptoms, which is concerning, but it is still stable. With that said, I want to again remind everyone that the average age of those diagnosed with COVID-19 continues to decline. Consistent with what we are now seeing nationwide, we're experiencing a notable increase in positive cases among young adults. Those in their 20s alone are now accounting for more than 21% of the cases in Missouri. 16% of all Missouri cases have been among those in their 30s. While younger, healthy people are less likely to have severe symptoms related to COVID-19, they can pass the virus on to others who are more at risk. So be responsible, protect yourself, but also protect others. We need everyone to take this seriously, no matter how old you are. And remember, social distance, wear a mask, wash your hands. We have a long way since March, and we must all continue to do our part to keep our family and friends and neighbors safe. In finishing up, this will be our only briefing again this week. Monday, we met with Truman State and Northwest Missouri State to discuss higher education's reopening plans. Tomorrow and Friday, we will be meeting with leaders of the University of Missouri, Lincoln University, Missouri State, Missouri Southern, and Southeast Missouri State. As always, please continue to be safe, be smart, and be responsible. Thank you, and God bless. Dr. Williams is also here. He's going to take a few questions, and then we'll take a few questions after that. Dr. Williams.
Thank you, Governor. Just a few remarks to build on what the Governor said. You know, as I think about where we've been since March, I go back to my clinical days as an obstetrician. Pregnant women can bleed a lot at times, an abruption of placenta previa. And your job in that case is to stabilize them as quick as you can, get blood into them. They have an increased blood volume and try to restore that. And so we found ourselves in March in Missouri trying to stabilize our state as we had this new virus come in. And we did that. We peaked on April 7th. But we find ourselves now, just like we do clinically, when we stabilize a patient, we then start into recovery. In obstetrics, that would be getting more blood in the blood bank. And in this case, it has been building out our capacities within the state so that we can deal with any more ongoing problems. And I'm going to repeat that. We do that to learn so that we can build out our ongoing capacities. And our capacities here in Missouri in August 5th are much different because we've learned and we've adapted and we've worked very, very hard with a lot of people. And I want to talk about that. The Governor mentioned the testing. We're now doing 94,000 tests a week. There wasn't even a test for COVID-19 in February. So that's an incredible development. If you looked at our boxed-in strategy, which is recognized nationally, we've done almost 100,000 tests on people and staff and residents in our long-term care facilities, which I was on a phone call this morning with our intensivist in Kansas City, Lee Norman, the health director in Kansas, and I do that every Wednesday, and they've commented just how different their patients are in the last month, even though our numbers have risen, to the fact that their R0 now is 0.91. It's less than 1. Now, it's gone up in St. Louis, but as you remember, just 2 weeks ago, our R0 in Kansas City was 1.3. This morning, it's 0.91. So we've incredibly built out our capacity for our most vulnerable, fragile patients. And so that's very much had an impact, even as those numbers have risen, on our morbidity and mortality and hospitalizations, which as of this morning were stable, right around 900. So we use all that we've learned in an incredible alignment with our federal and state and local partners, a lot of heroes, to be frank with you, that gives us at this moment in time, 5 months later, much, much more capability to deal with whatever comes. And why is that so important? Because as we work with our federal partners, we have a conversation with them this afternoon at 3:30 about a vaccine, Operation Warp Speed. And I was on the phone again with the intensivist in Kansas City this morning, and they are part of the clinical trial of a vaccine out of Oxford. And so I highly commend the people in the Kansas City community, both on the Kansas side and the Missouri side, to participate in that trial. These are all very, very promising. And so our hope is that by continuing to learn, continuing to work, continuing to adapt, that we will get to the point where we have a vaccine, which I hope will be in December or January, that we're developing in parallel. Again, our colleagues at Pfizer and WashU and SLU and University of Kansas Medical Center are doing that very hard so that there is light at the end of this path. And we are doing everything to bridge us to get to that place and have tremendous capacity. So again, very thankful to our federal partners, the CRAFT team here, which is the COVID Response Assistant Field Team. They were in Kansas City about 3 weeks ago, and our R0 there is now 0.91, dropped from 1.3. Our R0 has increased in St. Louis, and they're on the ground there today. I'm their point person and talked with them yesterday. They briefed the governor this morning. So we're incredibly appreciative to them for coming in, as Vice President Pence said, and helping us, because in Kansas City, at least, it's clearly, I think, made a difference. So with that, thank you. As you know, State of the State today in Missouri is our R0 is running about 1.3 with differences in Kansas City and St. Louis. Our hospitalizations are stable. Our 7-day rolling average is 9.9%. When we look at that, heavily influenced by 20 and 30-year-olds. So I'll conclude these remarks as we move forward. Missouri State Bears, we want to recognize them as we move back over from east to west. We recognized the Blues last week. But as they return to campus, we want them to be safe. And as the governor said, wash your hands, social distance, and if you can't social distance, wear a mask, especially among our 20 and 30-year-olds. So with that, Kelly, happy to answer any questions.
Hi, Dr. Williams. If we do see several schools offering in-person learning, as the governor just mentioned, I believe it's largely popular in rural areas, does the state have enough employees to help with contact tracing? We've seen that backlog in cases statewide. We've also seen, I believe it's nationally, that those delays in test results. This could result in real problems. Basically, is the state prepared to send kids back to school?
Yeah, thank you. It's an excellent question. And you know, we've worked very closely with Margie and Desi on this. And to your point, it's just vital that as soon as a student is identified, that student either self-report or that the school become aware of that. And that needs to be done in a very time-sensitive way. And so to your point, that involves very rapid contact tracing. So you need to get the test results back, you need to notify the student as quick as you can, and you need to notify the school as quick as you can. And Margie and I and others on the federal level have been working on that today to expedite that. So it's a great point, and we will have that in place because, to your point, it is time sensitive. So thank you.
Good afternoon, Dr. Williams. Senate Minority Leader Rizzo had called for testing, COVID-19 testing, during the special session, which your department has done for lawmakers, staff, and even Capitol reporters. Can you tell us how that's gone, and do you have a number of how many positive cases? Thanks.
I do, and I know it, and I've just got to make sure it's the right time to share with you, but we will get that to you. I just want to make sure the Senate and House leadership have seen that today. But we are prepared to give you how many tests we did. I think it's 292. And we're prepared to tell you the number of positives because it's aggregate. It won't reveal anybody's identity. And I know it, but if you'll just forgive me, I just want to make sure my charge to my staff this morning was to make sure the Senate and House leadership knew before we release that. If I find that out at 4 o'clock, we'll let you know. But we are going to give that to you.
Hi, Dr. Williams. So as the pandemic progresses, counties are kind of beginning to deviate as they tailor their responses to their individual communities. Do individual county health departments have the authority to issue mandatory mask mandates, or who does that fall to?
Yes, they do. As the governor has said, that our guidelines they have to follow, but if they want to exceed those because of their local prevalence, and other items as well, then they certainly have, and we support them in that. And we've seen that with Rex in Kansas City, and Fred in St. Louis City, and Spring in St. Louis County, and Stephanie in Boone County. So we certainly support that. If they think their prevalence dictates that, then we certainly support that.
All right, thank you, Dr. Williams.
Thank y'all.
Governor Parson?
Hi, Governor. Can you, I was wondering what your reaction was to the Medicaid expansion vote last night, and then how do you anticipate going about implementation of the expansion?
Yeah, well, you know, the people of the state of Missouri voted that in, so we're going to have to deal with it and implement it, and it's one of the reasons we put it on the August ballot. So if it did, we could somewhat have time to prepare for that, and we'll prepare for that. We'll implement it, and we're just going to have to find the money to be able to pay for it. But we'll figure that out.
So do you think that this is something that the legislature will spend a lot of time debating in the spring after you deliver your budget recommendations?
Well, I don't know what the legislators do with it, but the people voted for it, so we're going to implement it in the state of Missouri because that was the will of the voters, and we just got to figure out. The big thing is, where do you find the funding for it right now? You know, you're probably looking at $200 million or something like that off the bat, so we got to figure out where that funding is going to come from. So, you know, hopefully economy gets better. Hopefully we can meet that financial obligation a little easier, but right now it's tough times.
Thanks.
Hi, Governor. I know you didn't bring this idea up yourself last week, but it came up at the school meetings last week, the idea of using the National Guard as substitutes if necessary. Is that something you're seriously considering at this time?
Yeah, I mean, we took all the suggestions they took. I don't know that we're going to implement the National Guard for substitute teachers yet, because one, most people in the Guard may be teachers, full-time teachers now, that they may be in a classroom somewhere. But I think we're looking at different waivers we might be able to do to help get more substitute teachers in there, whether that be student teaching or who's available out there. Maybe teachers are retired, how to waive maybe some of the hours and stuff. We're looking at all those possibilities, how we can help the school systems to get back. But look, I think everybody out there, again, I credit the administrators for looking forward to looking what if this is a problem, how are we going to deal with that? And most of them are in front of that. So it's one of the questions they ask, and they're figuring out how to prepare for that.
Jacqueline?
Hi, Governor. There's been a lot of conversation around reducing the prison population, so I want to switch gears to the special session agenda. This special session package, the fiscal note, is showing an increase in prisoners, specifically juveniles. There's also language to eliminate the chance of parole. So could you just explain how this special session package kind of aligns with the comments that you've made about reducing the prison population?
Well, first of all, we have reduced the prison population from 32,000 down to, I think, somewhere around 25,000 since I became governor. Second, you got to just keep in mind special sessions about violent crime. When you talk about juveniles, you're not talking about little minor juvenile violations. You're talking about people involved in violent crimes. If you're talking about penalties, more penalties it'll be because people that commit violent crimes. We're talking homicides. We're talking about rape. We're talking about aggravated assault. It's strictly about violent crime.
Governor Parson, I was wondering if you had a comment or your reaction to the Lake of the Ozarks once again making national headlines over the weekend because of a concert.
You know what? I don't even know what the national headlines were, I guess. Most of the time I'm busy trying to deal with Missouri, but I'm not aware of what that situation was, I guess.
There was a concert with people standing next to each other, very close to one another, and TMZ released it, and you can see them all standing very close, and hundreds of them. I don't know if you have a reaction to that because you said social distance. Disappointing
is all I can tell you. In the state of Missouri, every day for months we've been up here telling people social distance, social distance. But again, people have got to take this responsibility on their own to be able to implement this. The quicker we stop doing things like that, the quicker the state's going to get back on track where it needs to go for people's safeties, for people to get back in a classroom, and for the economy to move forward. But people are going to have to take the responsibility of the behavior. That virus is out there, and it's not going anywhere right now.
We'll take two more questions. Jan Lake and then Brian.
Hi, Governor. Do you have any specific thoughts on what you want the legislature to do to help limit the costs that you've been talking about?
I'm sorry, the what?
The costs.
For the Medicaid expansion? Or
yes.
For cost on the Medicaid expansion?
Yes.
Well, I mean, right now we'll have to go through the budget process on that as we get closer to the year. We're just going to have to figure out, one, it depends what the economy does in the next several months, you know. The good news is things will look a little better right now than what we thought it would. On revenue, people going back to work, so those are good signs. But I think you're really going to know a lot more of the financial of the state probably in the last quarter. I think when we get to probably October, November, and December, you're going to know a lot more about it. But then we're just going to have to prepare a budget. You know, the Constitution is pretty plain. You got to balance that budget. So hopefully things get a little better. But we got a ways to go to get there, and we're going to have to implement that. So we got to get prepared for it.
Yeah, Governor, good afternoon. I want to follow up on your phone conversation with Vice President Pinch. You mentioned he's offered additional resources. What is he offering, and can you share a little bit about the conversation, what he said?
Yeah, I think, you know, one of the conversations we had, if you look at Texas, if you look at Arkansas, if you look at Illinois, some of the surrounding states, how high they've been over the last months, and you know you're right in the center of that, And, you know, I think we're all concerned at what point is some of that going to come into the state of Missouri? And with Kansas City sitting where it is, where St. Louis where it is. And I think the thing is we knew that those numbers were going. We're concerned about it. But I think the other thing, it's way early, too. I mean, the good news is they are seeing that before it gets out of hand or any situation we get in a worse situation. So they're basically saying, hey, we're here. We're going to send the CDC in there to help. And I encourage all the help we can get in that area to make sure we curb this as soon as we can. Again, we're just trying to stay ahead of this where we were somewhat chasing it all before in March and April. We're not defensive against this anymore. We can take certain actions, try to prevent this thing and spread it to get it level off. And I think you're starting to see that a little bit in St. Louis. I think they're reporting that out of there. But it's still it's a big city. It's a big population. We know that's a big risk. So we're keeping an eye on that pretty close every day. Thanks, everybody. Thanks.